Centre for Cultural Diversity in Ageing is funded by the Department of Health, and our vision is that all aged care consumers in Australia experience inclusive and accessible care. We are part of the Partners in Culturally Appropriate Care program. So for those that don't know about the Partners in Culturally Appropriate Care program, it is a program from the Department of Health which aims to deliver culturally appropriate care and to support aged care providers around what are some of the needs facing your diverse consumers and their carers and advocates. And also, how do we program towards more inclusive organisations? How do we address systemic discriminations and perhaps health inequalities? Some of our service areas include inclusive practice training and workshops that we're doing today, diversity advice and coaching, and capacity building for the sector around multilingual resource development, our website, and of course, our range of resources, our practice guides, our communication cards, and our inclusive service standards, which we'll be talking about today. So without further ado, I would like you now to have the privilege to be able to listen to Rebecca Cross, who's the Education Coordinator for the Aged Care Quality and Safety Commission. Beck has worked for over 20 years in the regulation of aged care and has focused her skills on developing and facilitating education to the sector with the education and engagement team at the Commission. Beck has had a strong background in assessment methodology and the aged care quality standards and has witnessed many periods of reform and change. So thank you so much, Rebecca, for your time today.
Thanks so much for that introduction, Lisa, and also thank you for inviting the Commission to be a part of your webinar today. I'd also like just to start off by acknowledging the traditional owners of the land in which we're meeting today, and I'd like to pay my respects to elders, both past, present and emerging. So the Commission's vision is that older Australians trust and have confidence that aged care services protect and enhance their safety, health, wellbeing and quality of life. Consumers of aged care services and their wellbeing are at the heart of everything that we do at the Commission, and Commission staff share a strong commitment to improving all consumers' experiences and outcomes for care. Many of you would be quite familiar, I expect, that aged care services are required to demonstrate performance against the aged care quality standards. There's 8 standards and there's 42 requirements that fall under those 8 standards in total. So the quality standards provide a framework of core requirements for quality and safety. So each of those 8 standards focus on different aspects of how you provide care and ensure quality, and they represent a minimum or baseline level of performance of what providers are required to meet. So many providers will already be going beyond those core requirements to provide a higher quality of care and services to your consumers. So today, what I'm going to do is talk a little bit about each of those 8 standards, but specifically highlight the requirements under those standards that link to the inclusive service standards that have been developed by the Centre for Cultural Diversity in Ageing. And then Lisa will talk about those performance measures and how they align to the requirements that I'm going to talk about. The document that outlines the inclusive service standards actually referenced as a key resource in the book that the Commission has available on their website around guidance and resources for providers to support the aged care quality standards. The quality standards have a consumer outcome philosophy where the focus is on the outcome for consumers and their lived experience. So this means that an aged care service provider needs to consider how you engage with consumers, with their families, carers and representatives, to ensure care and services are co-designed and developed to meet your consumer needs, preferences and goals. So the standards focus on putting the consumer at the centre of the decision-making role or process about the care and services that they want to receive. And the Commission is particularly interested in the outcomes that you do achieve for your consumers. So how you know what is happening for consumers and that you seek to make improvements to consumer outcomes. So we want people to really think about what is happening in practice and what is the experience of your consumers. So when we consider the standards and diversity and inclusion, it's important that we don't consider and treat everyone as the same, but consider what each consumer needs and wants and the support that you can provide to ensure their diverse characteristics are valued and respected and they feel included. So looking at the image, the picture on the screen, we've got a sporting match. And if we look at the picture on the left-hand side, first image, it assumes that everyone will benefit from the same supports. So they're being treated equally. However, not everyone's needs and preferences are being met using this mindset. If we look at the image in the middle of the page, the individuals are given different supports to make it possible for them to have equal access. So they're being treated equitably. And if we look at the third image on the right-hand side of the page, all three can see the gain because the inequity was addressed and the systemic barriers have been removed. So I guess thinking about these images and the quality standards, it's thinking that the quality standards have a focus on outcomes for consumers and ensuring inclusivity for all. And to ensure inclusivity, we need to consider the barriers for consumers and how we can remove those barriers. I've borrowed this slide actually from a presentation that Lisa did for our quality assessors a little while back at the Commission. I just thought it was a really great pictorial around diversity. So the quality standards require organisations to recognise and respond to the breadth of consumer diversity and ensure all consumers feel valued and respected and have their individual needs met. So think about the diversity of your consumers and how you ensure you meet their needs, preferences and goals through the lens of diversity and inclusion. Diversity recognises that consumers will have varied needs, characteristics and life experiences that they will draw on. So they may have specific social, cultural, linguistic, spiritual, psychological, medical and care needs. Diversity also recognises people's identities and relationships, their ethnic identity, lifestyle, history of discrimination, education and so forth, as we can see from the characteristics displayed on the diversity jigsaw. So really when we think about it, no two people's lived experiences are the same. Diversity and inclusion should form part of your strategic direction and systems to deliver high quality care and services to consumers. So the quality standards require all aged care service providers to recognise identity, culture and diversity in their service delivery and ensure that your services are inclusive. So some of the key concepts that are identified in the quality standards are displayed on the slide for you today. It's not all the key concepts that are included in the standards, but I thought these ones were particularly relevant to the discussions we're going to be having today and just being able to draw those links to inclusive service standards. So the first one is around dignity and respect. So being treated with dignity and respect includes recognising consumers' strengths and actions to empower them to be independent. It also includes communicating respectfully and recognising and respecting a consumer's individuality in all aspects of care and services. The second kind of key concept is around identity, culture and diversity. So all aged care services are expected to deliver care that is non-discriminatory and inclusive. Respecting a person's identity, culture and diversity also means understanding an individual's needs and preferences and providing care and services that is reflective and responsive to those needs and preferences. Choice is also central to quality of life in aged care. So quality is influenced by the consumer's right to make informed choices and to retain independence for as long as they wish. Communication is also an important part of choice. So just because someone is not able to communicate in ways you expect them to does not mean they can't participate in decision making. Services need to consider and have knowledge of what is important to consumers. And our fourth key concept on the slide is around cultural safety. So this is how a person's identity is respected so that who they are and what they need isn't questioned or denied. The consumer defines what cultural safety is. The key features of cultural safety are understanding a consumer's culture, acknowledging differences and being actively aware and respectful of those differences in the ways that we plan and deliver care and services to the consumers. To deliver culturally safe care to your consumers that is affirmative, it's trauma-informed and it's person-centred, centred requires an understanding of the histories and appreciating their unique identities, strengths, and vulnerabilities that lead to a range of shared and specific experiences. So I'm just going to talk now about each of the 8 standards and in particular the requirements under each of those 8 standards that relate to the inclusive service standards. So standard 1, which is around consumer dignity and choice. Standard 1 is a foundation standard. So the image that I showed earlier that had the standards wheel, you'll see standard 1 is the image that sits in the middle of the wall. The wheel. And that's because it really is linked to all of the other 7 standards. So consideration of consumer dignity and choice underpins everything that you do and will play a key role in how you demonstrate that you're meeting the standards and the requirements. So standard 1 recognises the importance of a consumer's sense of self and highlights the importance of the consumer being able to act independently, make their own choices and take part in their community. So these are all important in fostering social inclusion, health and wellbeing. And some of the key concepts you'll see on the screen here I had spoken about a few minutes ago. And the other ones that are relevant to standard 1 are around, personal privacy. So an aspect of dignity and respect is ensuring consumers' privacy is respected. When we talk about information being a key concept, it's about giving consumers timely information that in a way that they understand. So this is critical to their ability to make informed choices, and the kind of information and the way it's communicated will be influenced by both the capacity and the needs of the consumers. So think back to the diversity characteristics, because that may influence how you provide information to different consumers and how different consumers would like to receive information so they can make those informed decisions. And the last one there is around dignity of risk. So consumers have that right to make decisions that affect their lives and to have those decisions respected, even when there might be a level of risk that is involved in those decisions. So there's 2 requirements that sit under standard 1 that are linked to the inclusive service standards. So requirement 13A, each consumer is treated with dignity and respect, with their identity, culture and diversity valued. So people are shaped by personal characteristics, experiences, values and beliefs. Consumers have the same diversity of characteristics and life experiences as the rest of the wider community do. Each consumer has social, cultural, language, religious, spiritual, psychological and medical needs that affect the care, services and supports they need. So as I said earlier, no 2 consumers or no 2 people's lived experiences are the same. So what is respectful and dignified for one consumer might not be for another. Organisations need to take the time to listen to and understand each consumer's personal experience and work with consumers in an inclusive and respectful way using a consumer-focused approach. It's important for an organisation to address diversity, whether or not a consumer has told you about their unique life experiences or characteristics. Using strategies to support the organisation's commitment to diversity helps consumers to feel confident that sharing their identity, it helps them feel confident sharing their identity and also helps the workforce to see them as a whole person. The second requirement is about having an understanding of the consumer's cultural identity and that leading to better care and service outcomes for consumers. Again, what is culturally safe for one consumer can be different to what is culturally safe for another consumer. And this can be true even among people who identify as being from the same group. So to deliver care and services that are culturally safe means working with the consumer and others that they want involved so that their preferences and needs are understood. You need to know what to do to make each individual consumer feel respected, valued, and feel safe as well. So some things to think about around standard 1 and these requirements is how would a consumer know your organisation is inclusive, and what supports them to express their culture, diversity and identity if they wish to do so? Do your consumers feel accepted and valued, whatever their needs, ability, gender, sexual orientation, religion, ethnicity and so forth might be? Think about, do you tell consumers how you support their identity, culture and diversity? So looking at standard 2, so standard 2 is about ongoing assessment and planning with consumers. Some of the key concepts of Standard 2 focus on partnering with consumers. So partnering with consumers to understand what is important to them, involving them in the decision making as well. So this means listening to what consumers want, looking at what they can do, and understanding and responding to each individual's needs and experiences. So you can see how the partnering with consumers links to what I've already spoken about with cultural safety. So planned care and services should meet each consumer's needs, goals and preferences and optimise their health and well-being. So when considering a consumer's well-being, it's important to understand the individual's emotional, spiritual and personal preferences. So in terms of the requirements for Standard 2, we have one requirement that's linked to the Inclusive Services Standards, and that's requirement 2.3b. So consumers, regardless of their health and abilities, will have goals they want to achieve, roles that have meaning for them, and will want to live as well as they can. So looking at requirement 2.3b, organisations are expected to do everything they reasonably can to plan care and services that centre on the consumer's needs and goals and reflect their personal preferences. So this means, for example, listening to and understanding what's important to the consumer, tailoring an approach to fit the consumer's cultural and personal preferences and how they want care and services to be delivered. So it's expected with this requirement that advanced care planning and end-of-life planning happen in line with consumer preferences. So some things to think about is how do you know consumers feel listened to and their care and services are planned around what is important to them, such as intimate relationships, spirituality and culture? How does your organisation make sure they give consumers culturally safe and supportive opportunities to talk about dying so they can make their wishes known? How is this done in a way that meets the needs of a diverse range of consumers? I attended a workshop yesterday and someone raised that as an example that they have what's called a death cafe. And the Deaf Cafe was implemented because they found with their mix of consumers and a very kind of multicultural mix, that death was often a taboo subject for people to talk about. So they've opened up a Deaf Cafe to provide the opportunity to talk about end-of-life planning, and that's open to consumers, and then there's forums for representatives and family members as well. So I thought that was a really great initiative around how you identify those things that are important to the consumers around the end of life and what those wishes might be. So also think about how you monitor that a consumer's assessment and care planning includes the consumer's social, cultural, language, religious, spiritual, psychological and medical needs as well. Okay. So Standard 3 is around personal care and clinical care. It sets out the requirements that underpin the delivery of consumer-centred, safe, effective and quality personal and clinical care. So this standard will apply to any services that do deliver personal care so that might be bathing, assisting with toileting, assisting with eating or clinical care such as nursing services. So the standard focuses on care that is safe and right for the individual. Identity, culture and diversity of each consumer influences whether care is viewed as safe and right. It's tailored to the individual and based on the assessment of a consumer's needs, goals and preferences. It focuses on optimising health and well-being, including their physical and mental state, their spiritual, emotional and social life, cultural values, their attitudes and relationships. And this is underpinned by best practice as well. So where there are best practice guidance about how safe and effective care should be delivered, then that's something that services should also consider. In terms of the inclusive service standards, we've got one requirement that sits under personal care and clinical care, and that's requirement 3C. So this requirement focuses on how personal and clinical care is delivered at the end of a consumer's life. Understanding that dying and death are part of each consumer's human experience, not just a biological or medical event, needs to underpin all of end-of-life care. Organisations that take the right approach will deliver care that is culturally safe, provided in the most suitable setting, and deliver it in a timely manner. There needs to be a timely response if a consumer is in a physical, psychosocial or spiritual distress to ensure suffering is prevented or relieved and their dignity is maintained. So some things to think about when we're looking at this requirement in Standard 3. What processes are in place to support conversations with the consumer and others the consumer wants involved about their cultural, spiritual and physical needs? What would your consumers say about feeling supported to die in line with their social, cultural, religious and spiritual preferences? Also thinking about how your consumers' needs, goals and preferences for their end-of-life care are reflected in their care and services plans, including situation, the environment and the place where they wish to die. Standard 4 is about services and supports for daily living. So delivering services and supports to improve a consumer's wellbeing and quality of life requires a consumer-centred approach. This means treating the consumer as a whole person and considering their physical, mental health, spiritual, emotional and social life. As previously mentioned, like their relationships and attitudes, cultural values and the influences of those around them, including family and community, are all important. Optimising independence requires an understanding of the consumer's life history, culture, diversity and values. Organisations need to work with consumers to support them to have control over their daily life, remove barriers to participation. So, for example, it might be sensory deficits, functional barriers, it could be language or access barriers as well, and tailor care and services to consumers' needs, goals and preferences. Another key concept is around maintaining relationships when we're talking about Standard 4 and ensuring the consumers feel connected with those who are important to them, both with inside and outside of the service. And the third key concept around Standard 4 is about improving quality of life. To provide services and support that improve a consumer's quality of life, we first must understand what quality of life means. So think about, what does quality of life mean on an individual level for consumers, because that will be different for everyone that's here as part of the webinar here today. We've got one requirement that is linked to the inclusive service standards in Standard 4 around safe and effective services and supports for daily living. So receiving safe and effective services and supports for daily living can help consumers to be as independent as possible and maintain a sense of wellbeing. When these are tailored to their needs, goals and preferences, this helps to improve the consumer's quality of life. So what is valuable and important to one consumer isn't always important to another consumer. Some things to think about when we're looking at services and supports for daily living and this requirement. Think about, how do you get feedback from your consumers that tell you about their satisfaction with the services and supports for daily living they receive, and the services and supports to help them to do the things they want to do, as well as whether those supports have improved their independence, improved their health, well-being and their overall quality of life. Think about what networks your organisation has developed to provide services and supports for daily living to meet a consumer's needs and goals. And again, taking into account the characteristics of a diversity within your service and your consumers. And how do you measure how safe and effective those services and supports are in improving a consumer's quality of life, their well-being, their health and their independence? So Standard 5 is about the organisation's service environment. Some of you may be aware that this standard only applies to the physical environment that the organisation provides. So, for example, that would be if you're providing residential aged care, if you were providing overnight or day respite, or you had a day therapy centre. So this standard doesn't apply to home care services where the environment is the consumer's home, or it doesn't extend to the environments that consumers might visit, for example, libraries, shopping centres and bowling clubs. The focus of this standard is on ensuring that where the organisation is providing a physical environment, that it's fit for purpose, it supports quality of life and promotes belonging, independence, function, interaction and enjoyment for consumers. We've got one requirement that sits under Standard 5, the organisation service environment, that links to the inclusive service standards. And that's about the environment being welcoming and easy to understand. It optimises each consumer's sense of belonging, independence, interaction and function. So this requirement is about creating an environment that is well designed and welcoming for all consumers and encourages that sense of belonging. Consumers will experience service environments differently depending on their backgrounds, their situations, and what they expect from an organisation. So a service environment that is designed to be inclusive helps all consumers feel welcome. The physical, emotional, social features of a space are all important parts of creating a welcoming service environment for consumers and visitors. So think about what signals does the service environment give about who the organisation accepts and provides care and services for. Do things like your posters, photos, artwork, reading materials that are available in public areas of your service show that it is an inclusive service environment? Are there clear messages of welcome that use inclusive language? What would your consumers say about the service environment encouraging that sense of belonging? Do you have spaces for consumers to interact with others or for quiet reflection, or spaces for religious or cultural practices if they are needed by your consumers? So they're just some things to consider around Standard 5. Standard 6 is about feedback and complaints. So this standard is intended to encourage consumers to provide feedback to their organisations about their experience within the service, whether positive or negative, and is also intended to focus on the qualities of a complaints management system that drive continuous improvement. The key concept here is around open disclosure. So it's important to remember that open disclosure is not just confined to clinical care. An adverse event or circumstance can relate to the social and psychological aspects of the consumer's care and services. This standard also acknowledges that it's important for consumers to feel safe and comfortable in giving feedback or making a complaint. So we have two requirements here, requirement 6.3b and 6.3d, that relate to the inclusive service standards. So firstly, if we look at requirement 6.3b, this requirement is intended to ensure all consumers can easily make a complaint, whatever their culture, language or ability. The organisation's complaint system should give every consumer equal access to make a complaint or give feedback. Some of your consumers will face particular and additional barriers to providing feedback and making complaints. So it could be because consumers have cognitive or communication difficulties, or it may be language or cultural barriers. Organisations are expected to support consumers to make complaints. Your complaints resolution scheme must be accessible, confidential, prompt and fair, and it must support all consumers to make a complaint or give feedback. So it's not a one-size-fits-all approach. It's expected too that consumers are made aware of support and access to services that can assist them to make a complaint or give feedback too. Requirement 6.3d. So the organisation is expected to have a best practice system to manage feedback and complaints and use this system to improve how you deliver care and services. As well as encouraging complaints and asking for feedback, organisations should provide timely feedback to not only the organisation's governing body, also your workforce and consumers on the complaints and the actions that you've taken. So some things to think about. Is information about complaints available in languages and formats that different consumers can use? Do the complaints received reflect the diversity of consumers using your service? If not, are there barriers to some consumers making a complaint or accessing an advocate? How do you share what your organisation has learned? How do you involve consumers and the workforce in reviewing information from feedback and complaints to drive improvements? Would your consumers describe a range of ways that they can be involved in finding solutions to issues that they have raised in feedback and complaints? And is it inclusive of the diverse range of consumers within your service? So Standard 7 is looking at human resources. This standard supports all other standards and it focuses on the organisation having a skilled and qualified workforce sufficient to deliver and manage safe, effective, quality care and services in a safe and comfortable environment. So an effective human resource system supports the competency of an organisation's workforce and the delivery of safe, respectful and quality care and services. When we look at Standard 7 human resources, the links to the inclusive service standards actually links with all 5 requirements in the quality standards under Standard 7. So in day-to-day interactions with consumers, the workforce is expected to treat each consumer as an individual with their own unique life experiences, preferences, needs, and abilities. That consumer-centred approach needs the workforce to work with consumers in a flexible and responsive way to understand the individual's identity, culture and diversity, and foster appropriate interactions. So to do this, the workforce must also be able to communicate and engage in positive relationships with consumers. So I think we can never underestimate the power of those positive relationships and building rapport between the workforce and consumers. The workforce needs to have the skills, qualifications and knowledge to provide care and services. And when recruiting, organisations should identify the specific requirements of roles and reflect on the outcomes required by these standards. Organisations need to regularly assess the performance and capabilities of the workforce as a whole. And this is critical to the organisation's ability to deliver safe and quality services that are responsive to the needs and preferences of consumers. So it's not just about assessing the performance around task-based skills, but in relation to those interactions with consumers. So some things to consider here would be, do consumers say the workforce is able to meet their social, cultural, spiritual, psychological, medical care and support needs? Do your consumers take part in training members of the workforce who provide the care and services to make sure the way they deliver the care and services meets their needs, goals and preferences? Some examples of where we've seen that happen would be consumers as part of interview panels, or consumers as part of onboarding or induction processes, where they come along and they talk about what does a meaningful life look like for them. So it takes away that focus on a task focus and about what's important to the individual. And thinking, does your organisation use innovative ways of working tailored to the diverse needs of your consumers? So the last standard is about organisational governance. So Standard 8 supports all other standards as well. It supports how the organisation focuses on each of the requirements of each standard strategically to make sure they run the organisation well. So it's about that provision of oversight and accountability of an organisation's work. And different organisations will have different corporate structures and governing bodies, and this standard recognises that that's not a one-size-fits-all solution for effective governance. One of the key elements for Standard 8 is around consumer engagement and partnering with consumers. So we're looking for organisations to demonstrate that you seek consumers' views, you listen to them and you learn from their experiences. Encouraging and supporting consumers to be partners in planning and decision making enables your workforce to better understand an individual's specific needs, goals and preferences and provide better care and services, which leads to better outcomes for everybody. So we have two requirements in Standard 8 that are linked to the inclusive service standards. Requirement 8.3b is about the governing body being responsible for promoting a culture of safe, inclusive and quality care and services. The governing body is responsible for overseeing the organisation's strategic direction and policies for delivering care to meet the quality standards. A culture of safe, inclusive and quality care and services is one that is embedded in all aspects of organisational life and it's owned by everyone. It's reflected in how the organisation communicates its meaning and purpose to the workforce, to consumers and also to outside of the organisation. And requirement 8.3c looks at how the organisation applies and controls authority below the governing body. So for example, the CEO, the executive team, the management team, and then right throughout the organisation. And as you'll see on the screen, it lists, I think it's 6 key areas that an organisation needs for effective organisation-wide governance systems, which lead to improving outcomes for consumers. So it's around information management, continuous improvement, financial governance, your workforce governance, ensuring that you're meeting that you've got systems and processes to meet your regulatory requirements, and familiar with best practice guidelines and government guidelines, for example, and feedback and complaints. So when we're talking about organisational governance and that partnership and safe and inclusive quality care, think about how you acknowledge and celebrate diversity with consumers within your organisation. Would your consumers say that your organisation asks them for their opinions about care and services that they listen to, and you make improvements as a result. Consider putting yourself in the shoes of the older person and recording your ideas, practices, and perceptions. How would the consumer feel about policy or practices, for example, around safe and inclusive care and services? How would they know what you do? What might it look like for them? Thinking too, is there representation of consumers on committees or boards, or what evidence have you got that you engage consumers in the planning and evaluation? So how do they actually shape the organisation's governance? Okay. Some of the common themes, I suppose, that I've just talked about that are reflected in the quality standards are around diversity, inclusion, cultural safety, choice and dignity, plus knowing the individual consumer's needs, preferences and goals. So really what is important to the consumer. So I thought I'd just leave you with a few questions that I've kind of spoken about already, but really pick up on some of those common themes. So thinking about your consumers' experience, and do you have an understanding of what your consumers' experience really is? So how would a consumer know your organisation is inclusive and would support them to express their cultural diversity and identity if they wanted to? How do you know if your consumers feel accepted and valued? Have you asked your consumers to share their experiences about whether they feel their identity, culture and diversity is valued and supported? Is the feedback representative of the diverse characteristics of your consumers? And how do your consumers know about your commitment to cultural safety? So I guess I'm just leaving those there for you to think about back within your own organisation or service. And lastly, just before I hand over to Lisa, we've got some great resources on our website. But just a couple I wanted to highlight was our online learning platform, which is called Alice. Currently, all services are entitled to 4 complimentary registrations until I think it's the end of October. You'll find more modules there about the standards, about some of the key concepts and other key concepts that are part of the standards on there. For those in residential care, there's information there around the serious incident response scheme, clinical governance, and we're adding to those all of the time. Many of you are probably familiar with the book, The Guidance and Resources to Support Delivery Against the Aged Care Quality Standards. But if you haven't yet had a look at that, I'd encourage you to access that on our website. It does get updated all of the time when new resources and guidelines become available. And it's a really useful document for thinking about what kinds of things, what kind of actions and evidence should I think about to demonstrate I'm meeting the standards. So a lot of what I've spoken about today is included in that book. So what I'll do now is I will hand over to Lisa, who will go into more detail about the inclusive service standards and the performance measures that link to those particular requirements that I've talked about today.
Thanks so much, Beck, for that overview of the standards and the way in which the Commission has started to now incorporate diversity and inclusion in core mindsets, and rather than it just being a nice thing to do or an add-on thing to do or a specialised kind of specialised field. It's really good to see that the government is now looking at diversity and inclusion as core business, and we're going to continue to have that conversation now through the way in which the Centre for Cultural Diversity in Ageing views diversity and inclusion, and how it may complement and have a collaboration with the quality standards from the Commission. Before we talk about the inclusive service standards that the Centre has developed as a framework to understand inclusive practice, I thought I'd touch upon the Aged Care Diversity Framework, which was launched in 2017. So this framework can support your organisation to start to think about or to continue to think about some of the groups that perhaps are underrepresented, that perhaps have barriers to quality of care, that perhaps have faced discrimination and have additional barriers. Now, we don't want to make assumptions, but there are reasons why these groups and these communities have been mentioned in the Aged Care Diversity Framework. So they have Aboriginal and Torres Strait Islander people, people from coal backgrounds, people that identify as lesbian, gay, bisexual, trans or intersex, people who may live in rural, remote or very remote areas, people living with a mental illness. And we know that the Victorian government has just put a lot of money into mental health at the moment after the Mental Health Royal Commission. And we have had conversations about aged care and mental health and the effects of COVID. People living with dementia or cognitive impairment, people with a disability, people separated from their children by forced adoption or removal, or the forgotten Australians, care leavers, again, forgotten Australians, people who are homeless or at risk of becoming homeless, veterans, including their partners and family members, and people who have experienced financial disadvantage or social disadvantage. So I guess this is a good starting point to start to think about how you may be programming or supporting diverse groups in your community and people who have additional barriers. So when considering people with diverse backgrounds and who may be vulnerable in our community, we don't necessarily suggest that we should be helping that person as an individual, which we should be, but it really should be coming from the system. The aged care system needs to be inclusive. Now, how do we do that? Like, where do we even begin? And as Beck mentioned, diversity inclusion has been included in their standards, but the Centre has worked with the Commission to develop a framework and a journey to work towards. And again, it's not just a nice thing to do or something that's a charity. Really, it's about a systemic approach in addressing discrimination. And it must start from the top, have a planned strategy and a system which allows for the monitoring of progress against goals and continuous improvement. So again, it's not just one program that you did in 2019. It's about that continuous improvement and it's ongoing in the organisation. And through our consultations with the sector over a number of years, the Centre for Cultural Diversity and Ageing developed the Inclusive Service Standards. So again, apologies if you already know about the standards, because we did run our webinar last month about the standards with Uniting, who have a diversity inclusion strategy and a good practice example. But we're going to just go over the Inclusive Service Standards and how they link with the aged care quality standards. So they were developed in 2018 by the Centre for Cultural Diversity and Ageing to support organisations to become better equipped at addressing the diverse needs of their consumers and journeying towards inclusive practice. They provide a structure and a framework from which organisations can embed inclusive practice across all of its moving parts, across the board level, to continuous improvement, to financial management, to program and design, to staff management, to everything, that it is incorporated throughout the whole organisation. If you're able to implement the Inclusive Service Standards, then organisations are able to articulate their responsibility to addressing diversity in a systemic way. They are able to understand the diverse interests, goals and needs of their consumers. They are able to empower their consumers to make informed decisions. And they are able to be flexible and accessible and are free of barriers and discrimination. Now, easier said than done. And we know that you all have your everyday, work life and compliance obligations, and you have crisis management, and you have, very complex situations that you may be coming across. But I guess we're here to support that journey, and that's what the PCAC Alliance is about. And we really want organisations to reach out to us to say, we really want to start looking at diversity and inclusion. Can you help us? Where do we even begin? Or, we're in the middle of our journey. We need some extra support. So you're not alone in this process. So what are the Inclusive Service Standards? We've got 3 standards. Standard 1 is a commitment to inclusive services. Standard 2 is developing systems that support inclusive services. And Standard 3 is capacity building for inclusive services. So they're the 3 standards. So if we look at Standard 1, which is commitment to inclusive services, what this means is that the organisation can clearly articulate its commitment to building an environment that responds to consumer diversity and embeds it in its service provision across all of its systems. So it means that there's a commitment from your leaders, from the board and from the executive management. And then that message is articulated and expressed throughout the organisation. So we're going to show you now a short clip, what that actually means. What does commitment to inclusive services mean? It goes for 1.5 minutes. I hope you enjoy it.
Standard 1. Commitment to inclusive services. We need to prove that we are dedicated and capable of building an environment that responds to consumers' diversity and delivers individualized services. To successfully meet the criteria for this standard, we need to develop organizational values and statements that commit to being inclusive, produce strategic plans and annual reports that highlight inclusion priorities and achievements, review and amend all policies so they clearly address diversity and inclusion considerations, and build diversity and inclusion priorities into organizational quality and continuous improvement measures.
That module is available on our YouTube channel and on our website if you wanted to embed that into your SCORE files in your learning management systems. And we have a longer learning module, so that's just a little bit of an introduction. Standard 2 is developing systems that support inclusive services. So if you've got commitment from the board, how do you now implement it through your organisation? And this relates to designing and implementing inclusive services based on evidence and consultation, and as what Beck mentioned in the quality standards. Let's have a look at what that means. Again, about 1.5 minutes.
Standard 2. Developing inclusive services. We need to design and implement services that are based on evidence, stakeholder expertise, and information from our consumers. In order to meet the criteria for this standard, we need to have processes that identify the diversity of consumers and our capabilities of responding to their interests and needs. Consult with stakeholder groups and organizations when developing and reviewing services. Use community and consumer diversity information to identify and respond to barriers, and have accessible feedback mechanisms that receive and respond to consumer feedback.
Standard 3 is capacity building for inclusive practice. So this relates to building the capacity of your staff and management through training and diversity and inclusion being included in your induction programs. And of course, incorporating diversity and inclusion in professional development and KPIs, team meetings, and through ongoing development of your staff and yourself. Let's have a look what that means.
Standard 3. Capacity building for inclusive services. Diversity and inclusion are too often seen as nice to have, nice to do, or specialist areas. However, it's about all of our services being able to address diversity. To meet the criteria for this standard, organizations need to provide management and staff access to the latest diversity and inclusion research, tools, and resources. Review the abilities of staff to deliver inclusive services and support their development where necessary. Develop induction, training, and ongoing education that reflect the organization's commitment to inclusive services and enable staff to effectively deliver on that commitment. And invest in personnel and information resources that support inclusive service provision. The inclusive service standards allow us to map out our own path to becoming an inclusive organization. As we navigate our way towards becoming an inclusive organization, we learn that there is no final destination. To be inclusive is to be on a continuous journey that requires us to learn about and respond to our community's evolving diversity, listen to consumers and involve them in their service delivery, and improve and amend our services so they meet our consumers' interests, preferences, and needs.
Recently, the Centre for Cultural Diversity in Ageing has tried to get its head around, the way in which the inclusive service standards link to the aged care quality standards. And we have done that through considering each of the performance measures under each of the standards. So we have 3 standards, as I've just mentioned, and under each standard there's a series of performance measures. Under Standard 1, there's 6 performance measures. Under Standard 2, there's 5 performance measures. And under Standard 3, there's 5 performance measures as part of the framework, the Inclusive Service Standards framework. This infographic is something that you can use at a glance. As you can see, the aged care quality standards are in the wheel there, and each of our performance measures are married to each of the standards. So as you can see with Standard 1, we've got all of our performance measures there in pink because we believe that consumer dignity and choice and culturally safe care relates to all of our standards, as well as all of the aged care quality standards. As Beck mentioned, it's a foundational standard. Standard 2 relates to the yellow one, relates to Standard 1.5 in our framework. Standard 3, the blue box, relates to 1.5. Standard 4, the purple box, relates to 1.5, etc., etc. So that's just something to look at a glance. This is available on our website as well for you to download or have a look at. And now we're going to go through all the standards of the aged care quality standards that Beck mentioned. Standard 2 for the aged care quality standards, which is ongoing assessment and planning. Standard 2 relates to performance measure 1.5 for us. Service provision reflects inclusive service approaches. So here are some reflective questions in relation to the way in which your organisation may consider diversity and inclusion in screening, assessment and care planning. Do we take into consideration the history of trauma, persecution and discrimination? Do we understand what stigma and shame may mean for your consumers when they're entering into a care planning or assessment process, that they're in a vulnerable position and there's power indifferences? How do they understand authority and government programs? How do we consider the diverse ways that people communicate, including cultural norms? How do people understand the aged care system, or what is consumer-directed care for different people, attitudes towards government services? And, of course, things like gender roles and the role of families in decision-making. And, of course, linguistic, cultural, religious needs and preferences, as Beck mentioned. Personal care and clinical care relates to 1.5 in our performance measures. Service provision reflects inclusive service approaches. So in what ways did your organisation consider diversity and inclusion for personal and clinical care? Things like the different beliefs around death and dying, as Beck mentioned already, culturally responsive dementia care, dementia units or dementia programs. Again, the different family roles and shame and stigma, gender roles and preferences, language needs, spiritual needs, ideologies, connecting people to services that they trust and to people that they trust, culturally appropriate food requirements, access to culturally appropriate resources, and also culturally sensitive attitudes towards mental health and wellbeing. These are just a few questions that we're going to elaborate in our diversity communities of practice. So this is just the starting point. Standard 4 from the Commission is services and supports for daily living. Again, this relates to performance measure 1.5, service provision reflects inclusive service approaches. In what way does your organisation consider diversity inclusion in supports for daily living? And these can be quite repetitive. So it's pretty much similar to personal and clinical care. So I won't go through that, but there's an additional one there around culturally appropriate entertainment and multilingual resources like SBS Ethnic Radio, international TV stations, and, of course, access to culturally appropriate social supports. The fifth one is the organisation's service environment. So this relates to 1.5, the service provision reflects inclusive service approaches. In what way does your organisation consider diversity and inclusion in its physical and social environment? Things like multilingual signage or communication cards, multilingual information and resources across your organisation, effective translation approaches, sometimes it's not just a translation, it's a co-design. It's talking to communities to say, is the content right before we translate it? So with the COVID-19 situation, it was like, let's just translate this information into different languages, but the content wasn't always comprehensible. And it's the same with different types of health messages and public health sort of programs that sort of have a one-size-fits-all approach to translations, but it's not necessarily like that. And I know that there was a situation with the cancer. I used to work at the Cancer Council as a multicultural officer there, and we had to change our cancer messaging to fit the community, because not everyone, sort of had the same understandings of what cancer was. Of course, it was the same messaging around getting the right healthcare, but it was a different approach for communities. Prayer rooms and reflective spaces, as Beck mentioned, co-designing spaces with diverse communities, and access to culturally appropriate social settings and events and special significant cultural events. And your service environment can also be outside of your building. It can be at McDonald's, where someone feels comfortable to sit down and have a care plan. It can be obviously in their home. It can be on the street if they're homeless. So it's not necessarily a building. Standard 6, feedback and complaints. So this relates to our performance measures 2.2, 2.4 and 2.5. Things to consider around feedback and complaints is, how does your organisation collaborate and seek input with special needs groups to co-design? And I guess what we mean by special needs groups are those mentioned in the Aged Care Diversity Framework. So if you wanted to do a program around culturally appropriate care, have you reached out to your migrant resource centre or to your local Jewish group or Muslim community leaders or Sikh community leaders, for example? How does your organisation consider diversity and inclusive practice into feedback policies? And Beck did mention this, but I'm going to elaborate a little bit more around things like history of discrimination. When people are in the feedback process, again, power and privilege plays out. They're in a vulnerable position. They might feel scared to give feedback. They might not know how to give feedback. They might want to say yes to everything in case they might feel like they might be unsafe to give feedback. And we actually have our culturally inclusive feedback practice guide for you to help you with that. And we're quite passionate about this topic because we see quite a low usage of feedback from COLD communities, especially with government-related programs like the Royal Commission, for example, or just giving feedback to My Aged Care and other programs. So, yeah. Standard 7, which was human resources, relates to our Standard 3 capacity building for your staff, like key skills required, training and resources, key performance indicators and professional development, as we mentioned before. So how does your organisation provide training on diversity and inclusion across all your employees, across all levels of your organisation? Some of the key topics include cross-cultural communication, working with interpreters, diversity and inclusion in aged care, inclusive leadership, tapping into the cultural competency of your staff, existing staff, cultural safety, accessing multilingual information and inclusive consumer feedback. And of course, we have our webinar series that have all of our recordings are on our website. And so you can simply embed that into your LMS systems through the YouTube web links. So let us know if you'd like that to happen, and we can send you the links. We also have in our tips, templates and resource tab on our website a list of potential topics that you can cover around diversity and inclusion. There are lots of topics to cover. So let us know. We can also refer you to the right subject matter experts in the certain fields that you require. And of course, the partners in culturally appropriate care providers all have resources as well, so you can reach out to your state and territory provider. Now, the final one is organisational governance. And this relates to quite a few of our performance measures. So most of our performance measures in the commitment to inclusive services, of course, because it comes from the governance perspective, the readiness, the organisational audits, and the budget. Some things to consider. Do you have a diversity and inclusion committee, relevant working groups to do that continuous improvement? Does your organisation have a diversity inclusion strategy? Please let us know if you have a diversity inclusion strategy or an inclusion strategy or a reconciliation strategy or a rainbow tick, please let us know. We don't know what's out there. We're always trying to find, stories to inspire. We do have a Stories to Inspire arm at the centre, so please let us know, because we're finding it quite a gap in that field at the moment. And if you do find out, know anyone, let us know. And of course, we have our Excellence Awards celebrating good practice as well. So we're always interested in new and exciting programs. Well, they should be necessary, really. Has the organisation allocated a budget? And as mentioned before, things like translations, inclusive service training, targeted media campaigns, and inclusive program design implementation. And that's the end of my presentation and Bec's presentation. We thought we'd have a little bit of time now to look at some questions or reflections you might have. We've got a comment here from Kim. The webinar has highlighted the need of diversional recreation therapist role and leisure and lifestyle staff in delivering leisure and recreation programs, meeting individual choice, dignity, cultural, social, emotional, religious needs with such great tools and auditing tools. Thank you so much, Kim. Yeah, absolutely. In relation to the recreational therapist role, I think it's a really important role as it relates to, gathering the needs of the way in which diverse consumers and their carers might relate to, the way that they, their hobbies, the way that they connect with their environment, what interests them, where do they connect to people that they trust, what are some of the activities that they might feel uncomfortable with, where personal space might be an issue, or religious and spiritual needs may be compromised at times. So it's really, really good for you to be able to reflect on that. So thanks so much, Kim. And we have a comment as well that someone's just discovered that they have a policy around cultural safety. So thank you so much for discovering that and letting us know. And can you please email that to us, or we could have a chat about it, because we can put it on our Stories to Inspire section on our website. Thank you. Rebecca, do you have any comments before we end the seminar today?
I guess I just really enjoyed listening to your part of the presentation, Lisa, around the inclusive service standards, and can just see how it really does align with the aged care quality standards. And just some of the examples that you brought forward would be what assessors, some of the things that, service providers could present to assessors to demonstrate that you're meeting the diverse needs of consumers and that you do have that culture of inclusivity. And great too to see the comment there that someone has found that they have a diversity and inclusion policy. I guess it's more importantly, do people actually know about it? So right throughout the organisation, and do your residents or your clients or consumers know about that as well? Because I think it's important for them to have that understanding that you do have that culture of inclusion if they do want to share information. Yeah,
absolutely, Beck. And if that person would like to join our communities of practice, you're welcome to share the way in which you might have discovered that, or you're working on that, because we are with Uniting, when they showcased their diversity and inclusion strategy for 2020-2023, it took 20 months for them to develop the strategy, and it involved a number of different people. And so it's not just a 1 week thing that you tick the box on. So thank you for that comment. So the Aged Care Diversity Framework is the Department of Health stance on diversity and inclusion in aged care. Okay. And that's where the special needs groups were mentioned in the wheel, and that's in that framework. And from that framework are 3 action plans. Those action plans were developed in consultation with consumers and peak bodies and community leaders. They are Aboriginal and Torres Strait Islander peoples, people from culturally and linguistically diverse backgrounds, and people who identify as LGBTIQA+. Now, in those action plans are specific strategies to help your organisation address those 3 special needs groups. The inclusive service standards we see that as like overarching mindset so if you have the inclusive service mindset and framework, then you can embed the action plans into your work. But yeah, so because we also have to look at intersectionality, not everyone just identifies. A lot of people don't just identify as one thing. I mean, do we identify as one thing? No. I mean, I identify as many things, and it changes every day. My identity changes every day. But so we have lots of different intersections, and I know that's a bit of a rhetoric word, but someone who's from a culturally linguistically diverse background, who's a woman, who is a carer, who lives in regional Victoria, there's all those intersections, and that's why we advocate for an inclusive service approach rather than siloing people into certain categories and certain boxes. However, those action plans can help programming towards those special needs groups as well. So it's a very complex topic, and I was reflecting on why we even talk about diversity and inclusion, because all of humanity is unique, and we don't need to mention that. So why do we have to talk about diversity and inclusion? It's because people miss out. We have cultural norms in our society which, lead to marginalisation of certain underrepresented groups, people that can't advocate for themselves, people that, were a minister in Ethiopia and a taxi driver now in Melbourne. If you speak to some people from migrant backgrounds who are overqualified but can't get employment because of their language barriers. So, we've got so many different issues here, and even navigating the aged care consumer journey, for example, of ringing My Aged Care and getting a care plan. There's a reason why we have aged care navigators. We have aged care navigators because some people need hand-holding to understand the system, and then let alone, the needs of ethno-specific providers who, are perhaps not as large as the larger providers, the smaller providers, and the supports that they might need within the aged care service sector landscape. And, of course, you have the residential care environments and all the different models of care there. But how do we help to create a home and a feeling of home for older people? And I'm sure you're all aware what's come out of the Royal Commission is that we need to all work together to really improve the aged care system. It is, some of the stories coming out are really quite concerning around human rights, and that's why the government is now looking at a whole new act, a Human Rights Act. So, and a very strong focus on governance. So diversity and inclusion is essential. It's not just a nice thing to do. The Commission will be looking at how you consider diversity and inclusion. You've got the support from the PCAC Alliance to help you. We've got our Communities of Practice on the 7th of September. If you'd like to continue the conversations around what you're doing and how to get support. And Sarah's mentioned that there is a question. Yes, just wondering about cultural inclusivity in the community. There are no standards for community practice, unlike in Resi Care. I'm not sure what that question relates to in relation to standards, but perhaps we can, if you wanted to email me that question, we can have a chat about that, because from my understanding that the Aged Care Diversity Framework is a framework rather than mandatory standards. Of course, the aged care quality standards are mandatory, and our inclusive service standards are not mandatory, they're a framework. But there has been discussion in the budget of making diversity and inclusion reporting mandatory. So watch the space for that. We have the final comment, which is where can we get case studies, or where can we learn from our peers about what they're doing? And that's a great question. So we've been working for the last year or so on celebrating good practice. So if you go to our LinkedIn page or our Facebook page, we have weekly to fortnightly good practice examples around this space. So feel free to link to our social media channels. And we're thinking of transferring those good practice stories onto our website. So if you go to our homepage under good practice examples, you'll see at the moment we have our 2 videos where we've interviewed sector leaders around what they think about diversity and inclusion and what strategies they've adopted. So those videos, one of them goes for 8 minutes, the other one goes for 11 minutes, and you can embed them into your learning management systems, and it's peer-to-peer learning. So thank you, everyone. I think we might end there. But before we end, I'm just going to quickly let you know about our webinar series. This is the 7th webinar for this year, and we're really excited about this program. The next one is Applying a Diversity Lens to Consumer-Directed Care with the diversity consultant Dale Park on the 15th of September, and inclusive consumer feedback. So feel free to promote that to your staff. Thank you so much, everyone, for your participation today. It makes me realise that there's a lot more discussions to be had, and people are interested in this topic. So well done, everyone, and let's work together further. You've got your support. You're not alone. Thanks, everyone.